Hi, my name is Tamika Shaper. I'm going to be doing the second part of my medication administration video where I'm going to be locating the landmarks of the injectional sites. And here's my badge. I'm going to scan the room. Okay, so the first The first thing I'm going to do is I'm going to get my patient to flex out her arm, and I'm going to look for the Atrium process, and then I'm going to look for the Atrium process, and I'm going to put 3 fingers under it and form a triangle, and then in the middle of that V, is where I would inject in between those 2 fingers, and at a 90-degree angle because it is intramuscular. So now I am going to get my patient to move her arm in like that, and to expose the dorsolateral side of the arm. So I'm going to put 3 fingers under the deltoid muscle and 3 fingers above the elbow. And we're going to make sure we stay on that dorsolateral side, and we're going to inject in this area at a 45 to 90-degree angle because it is a subcutaneous injection. And yeah, that's the dorsolateral side of the arm. So now we're going to flip this arm over to the intradermal side. So I'm going to put 4 fingers under the bend of the elbow and 4 fingers above the wrist. And I'm going to make sure I don't penetrate any obvious veins or arteries. I'm going to have the needle facing bell side up so I can put a blade up under the skin. And we're going to go in at a 15-degree angle because it is, like I said, it's intradermal. And the site is in this area. So now I'm going to get my patient to lie on her side and face me. So this is the ventral gluteal. So I'm going to check for the greater trochanter. So I'm going to get my patient to flex her leg back and forth so I can locate that greater trochanter. And I'm going to place my dominant hand on the greater trochanter. I'm going to point my thumb towards the groin, my pointer finger towards that anterior iliac spine, and I'm going to point that middle finger towards the iliac crest. And in between my pointer finger and my middle finger, I'm going to insert it at a 90-degree angle because it is intramuscular. So now I am going to get my person to do, I'm going to do the abdomen. So my person down their back. So I wouldn't go past above the coastal margin, and I wouldn't go below the pubic area. I wouldn't go past the anterior superior iliac spine on either side. And I would go 2 inches to the left or the right of the umbilicus. And you would go in at a 45 to 90-degree angle because it is also subcutaneous. And depending on the patient's weight, you can inject more than one time if they have multiple injections. So now I'm going to move on to the vastus lateralis. So I'm going to get my patient to stay like this. And I'm going to feel for that greater trochanter. I'm going to get them to flex their leg up and back like that. I'm going to feel for that greater trochanter. And when I feel for it, I'm going to put 5 fingers below it and 5 fingers above the knee. And you wouldn't go past the midline of the thigh or the midline of the side of the thigh. And you would inject in that area at a 90-degree angle because it is also intramuscular. And that is all. Thank you.